Hi and welcome to Synapse. In today's video session, we are going to revise and learn about the Southampton score. So Southampton score is given in Bailey and Love in the initial chapters. So it is a score that is used to grade the surgical wounds, right? So I shall show the scoring system here. Okay, this you can find this in the Bailey and Love textbook of surgery. So 0 is normal healing, 1 when there is normal healing with mild bruising or erythema, 2 is when there is significant erythema with signs of inflammation, 3 is when there is discharge, clear or serosanguinous or hemoserous discharge, 4 is with pus discharge or purulent discharge, and 5 meaning deep severe infection with or without tissue breakdown. So everything is again further divided into A, B, C, and you can see the subdivisions here. It's kind of intimidating, so let me break this down to you. Let us start this. Okay, so we are going to talk about the first part. Okay, the grade 1, that was when there is mild bruising. Okay, when there is bruising around the site. So one was divided into A, B, and C, right? So let me just draw the suture site here. Okay, so that we can remember this visually, right? So this is our surgical wound, okay, that we have sutured, right? So the first one was mild bruising, right? So you will have minimal. So I hope you can see the blue dots. There is minimal bruising here. Okay, so this is how the wound looks. It'll be like greenish blue. It's basically the tiny bleeding that has happened while you close your so the incision site. So B is when there is significant bruising. Okay, this is significant bruising. Then C, when there is a mild erythema. Okay, so this is some amount of erythema that you're going to see. So this is Southampton 1A, which is mild bruising, B is considerable bruising, C is mild erythema. Now let us move on to the grade 2. Grade 2 we said was when there is erythema with signs of inflammation. With signs of inflammation. So this was divided again into types A, B, C. So I'll just quickly draw the suture site again for our better understanding. So erythema and signs of inflammation, which is at 1 point. So this is what you're going to see. So there's a lot of erythema here. Okay, at 1 point you're going to have a lot of inflammation. Fine. So B is when you can make out that there is erythema and signs of inflammation around the sutures like this. Okay. C is when there is erythema along the wound. Okay, you can see the redness and the swelling, everything along the wound. And D is when you have the erythema around the wound. Okay. 2A is when there is erythema at a point. B is when you have erythema around the sutures. C is along the wound. D is around the wound. That's with grade 2. Coming to grade 3, when we are talking about the discharge, what type of discharge is present here? It's either serous or it is serosanguinous. Okay, that is slightly, it can be mixed with blood. Okay, so again let me draw the suture material. Okay, so A is when you're having discharge which is coming at a small point. Okay, how shall I show the discharge? Okay, I'll use green. Okay, so green is serous discharge in this diagram. Okay, so when you have discharge which is coming at a point, so you're having serous discharge from this point. Okay, so In other words, they say if that discharge is from a point which is less than 2 centimeters, okay, that is called 3A, okay, from a single point. 3B is when you have serous discharge coming from a point which is more than 2 centimeters. So you're going to have more serous discharge here, okay. And C is when your discharge, the quantity is more. Okay, so I'll just show like this here. C is when the quantity of the discharge is more, and D is when it is prolonged. It's coming for more than 3 days. So you have prolonged discharge. Here we're taking the duration and not the quantity. Okay, it's prolonged discharge. Let's move to grade 4. Grade 4 is pus or purulent discharge. Pus or purulent discharge. This is again AB. So pus and purulent discharge I want to show with the red color only. So pus discharge. So you're going to have at one point. So this is the point from which your pus is coming out. So when you have this is less than 2 centimeters. Again here more than 2 centimeters. This is where you have a lot of pus coming from a lot of points. Okay, so this is grade 4B. So grade 5, you remember from the diagram that there is a deeper site infection or there is a severe infection because of which with or without tissue breakdown. Now if this is a surgical site, this one we have removed one suture, let's say in between, and after removing suture it will be looking like this. So just for the understanding, okay, I'll just try it differently. So this the suture site is the sutures are removed. This is the incision site, and you are seeing that there is a lot of discharge that is coming from underneath. There is a deeper tissue infection and there is severe infection, a lot of discharge that is coming, so you can find a lot of slough, okay, may or may not be associated with tissue breakdown, correct. So this is the pictorial representation of Southampton score. I hope putting the information in the form of diagram will make this table easier. So now you can go back, read this from Bailey and Love Short Practice of Surgery, and this will all make sense. So that's it for today's short video, and I'll come back with more topics like this. Thank you.
It's 1 o'clock.